Well, my name's Austin Sumner, and I was president of this organization in, I believe, 1984 and 85. There are many issues facing us at that time. I think it's fair to say that I was fortunate to be president at a golden era for EMG. Our techniques were considered cutting edge at that time. And there were quite a number of new techniques relevant to our understanding of especially peripheral nerve disease that were emerging as a direct result of the use of these techniques that had a real impact on patient diagnosis and management. In this organization has certainly been the most enjoyable organization with which to have been associated. I certainly worked my way through the ranks and had many roles in the growth of this organization. I think I was initially the chairman of the education committee. I was on the board for many years. I was a program chairman for the record meeting in Philadelphia in 1981, which was John Melvin's presidential term. And that was certainly the record-setting meeting for attendance up to that date. It was also record-setting, I believe, in terms of the quality of the scientific presentations. We were really coming of age. In mentioning John Melvin, I should add that John was always an inspiration to me. John was one of these rare individuals that was extraordinarily well organized. I learned a tremendous amount from him in terms of organizational skills, achieving objectives, working through committees, and I hope when I became president that I was able to apply and effectively utilize those skills. I want to take particular pride in what I accomplished as president in introducing the American Board of Electrodiagnostic Medicine. It was a very controversial decision for us to get into the business of certifying competency in electrodiagnostic medicine. I was fought tooth and nail in my enthusiasm for this move by my predecessor, Dr. Jasper Darby, whom I love to death, and all of you know that Jasper is a man of very firm conviction. But he felt certain that we shouldn't get in the business of certifying competency, and that we should restrict the examination that we were offering to being an educational experience rather than a certification of competency in the field. I felt differently and fortunately was successful in establishing the American Board of Electrodiagnostic Medicine. And I believe that looking back, that was a singular accomplishment that put a stamp on this body. I said it was a golden age because we felt at that era that we almost had the Midas touch. Everything we did worked. The organization just seemed to be in a vigorous growth spell. Everything was getting bigger and better, and the attendance at our meetings was steadily going up. The number of educational and scientific presentations was increasing. There were all sorts of satellite activities that gelled around the meeting, such as the special interest groups. And I would agree with Jasper that he and the executive director, Alan Van Lanningham, were responsible for putting us on a very sound financial footing. The most memorable aspects of my association has always been the interaction with individuals, especially other members of the board. We were a vigorous group. We exchanged ideas freely. We advocated our points of view, I hope with civility, and we all became very practiced and knowledgeable about Robert's Rules of Procedure. And indeed, it was that education in parliamentary principles that I felt was an enormous fringe benefit of my administrative experience in this organization. You know, my presidential meeting was in Las Vegas. Of course, it was not a site that I would have chosen, but it turned out that it was a truly memorable annual meeting. We had a large attendance, and I was especially proud of the International Symposium that was organized on peripheral nerve disorders as a satellite meeting of that, wherein we invited some of the really outstanding young investigators in the field, almost all of whom have gone on to make a major mark in our field. I'm thinking of people like Bill Brown and John Pollard from Australia, Klaus Teuker from Germany, Jack Griffin from Johns Hopkins, and the list goes on. John Prineus from New Jersey and Australia, individuals who have made singular contributions in the field of peripheral nerve disease. Has EMG changed? This is a question that most of us have been asked, and the answer is not very much. But for me, that's a cause of alarm, because I generally ascribe to the principle that if things aren't growing, expanding, they're probably going backwards. And I have a feeling at this time that we are in a relatively non-productive phase with respect to the things we do. Our techniques have utility, but conceptually we don't seem to have pushed the boundaries further back. We don't seem to have developed better tools for understanding the physiology of neuromuscular function. We are in danger of becoming dinosaurs in this era of molecular biology and brilliant new imaging technologies. And so I believe that the challenge in the future is to redefine ourselves in the light of these changing circumstances.